Welcome back. Now we turn to practical lessons from a successful effort to win approval for a huge increase in state funding for public health and prevention. The lessons come from my home state of Indiana. I can say from firsthand knowledge, Indiana is politically conservative. The last time it voted for a Democrat for president was in 1964, and Republicans have held a supermajority in the state legislature since 2011. The members of our next panel have great insights into building support in that environment for prevention, public health, and health equity. Governor Eric Holcomb spearheaded the effort, creating the Governor's Public Health Commission in August 2021 to examine the strengths and weaknesses of Indiana's public health system and make recommendations for improvements. He appointed Judy Monroe, CEO of the CDC Foundation, and former State Senator Luke Kenley as co-chairs. The commission issued its report in August of 2022, and Governor Holcomb mounted an effort to translate the recommendations into legislation. With a significant investment of leadership, the legislature passed and Governor Holcomb signed into law earlier this year a bill that increased state funding for local public health by 1,500%. It prioritizes chronic disease prevention, tobacco and vaping prevention and cessation, and immunizations, among others. While the National Forum Awards presentations will be made during the annual business meeting later today, one of them is completely relevant to this segment. We are pleased to recognize Governor Holcomb with the National Forum 2023 Public Policy Award.
Hello, I'm Governor Eric Holcomb, and I am deeply honored to receive the National Forum Public Policy Award. This recognition obviously belongs not just to me, but to the incredible team of individuals who have dedicated their time and energy to strengthen local public health in Indiana for years to come. Together, we've made great strides in our pursuit of better health outcomes for Hoosiers, and we'll continue to champion the fight against heart disease, stroke, maternal health, and so many others. The list just goes on and on and on. So we thank you for this award, and thank you for your unwavering commitment to healthier communities.
Congratulations, Governor. Leading the panel will be the 20th Surgeon General of the United States, Jerome Adams. Dr. Adams served as Indiana's State Health Commissioner before becoming Surgeon General. Today, he is a Presidential Fellow and Distinguished Professor of Practice at Purdue University and Executive Director of Purdue's Health Equity Initiatives. He also serves on the National Forum's Advisory Leadership Council. Luke Kenley served 25 years as an Indiana state senator, including 8 as chair of the Appropriations Committee. Before becoming a state senator, he served 15 years as a judge for Noblesville City Court. As you heard, he was co-chair of the Governor's Public Health Commission and was instrumental in building support for the resulting legislation. And Dr. Lindsay Weaver is the State Health Commissioner. She, too, played a key role in gaining support for the bill in her role as Chief Medical Officer of the Indiana State Department of Health. She is board certified in both emergency medicine and hospice and palliative care, and is an assistant professor of clinical emergency medicine at the Indiana University School of Medicine. Dr. Adams?
Hello, again, I'm Dr. Jerome Adams, former United States Surgeon General, former Indiana Health Commissioner, and we're really pleased to have you here today. Indiana offers lessons for public health advocates. That's what POLITICO reported when the state boosted public health funding by 1,500%. How did public health advocates gain buy-in for the resources and empowerment of local public health in Indiana's conservative legislature? Well, in this session, we're going to examine how Indiana Governor Eric Holcomb and public health advocates gained buy-in for the resources and empowerment of local public health in Indiana's conservative legislature, and we're going to share lessons from their success that can be applied to boost support for prevention and for public health in other conservative and GOP supermajority states. Indiana has a Republican governor and Republican supermajorities in both chambers of the state legislature. In fact, every statewide elected official is a Republican. Citing Indiana's declining life expectancy and low ranking on many health metrics, Governor Holcomb appointed a Governor's Public Health Review Commission in August of 2021 to analyze Indiana's current public health system and to identify both strengths and weaknesses, identify ways to improve delivery of public health services, fund public health, promote health equity, ensure sustainability of local health departments, and improve responses to future public health emergencies. Governor Holcomb charged the commission with identifying legislative proposals to address its findings and recommendations. The commission's recommendations were incorporated into Senate Bill 4. An advocacy campaign led by the governor and several people, including the two individuals joining me here today, got the bill passed. It increases state funding for public health, as you heard, by 1,500% and makes accepting the funding optional for counties. If counties accept funding, it requires at least 60% of the funds to be spent for preventive core services, including tobacco and vaping prevention and cessation and chronic disease prevention and reduction. So I want to jump right into this conversation. Senator Kenley, can you start off by telling us what your role in this was? You used to be a part of the legislature. Now you're, legislative emeriti. But you and I have talked about the importance of having a champion connector. So I'd love to hear your perspective on how you got involved in this and what role you played.
Well, thank you, Dr. Adams, and thanks for including me in the discussion. When Governor Holcomb had the press conference, his chief of staff, who I was very close to, had called me and asked me to be a co-chair on this commission. And so I said, out of just basic trust, I said, sure, I'll be glad to do that to help you. And I went to the press conference. And when I got done with the press conference, I went to talk to Governor Holcomb. I said, you may not have picked the right guy here. I'm not sure I'm even going to be for this. And he laughed and he said, well, look, we trust you. We know that you're trying to do the right thing. So dig in there and see what you can do to help us. And Dr. Box, who was Lindsay's predecessor as the health commissioner, and Governor Holcomb had done a series of virtually everyday presentations on TV during the pandemic. And although there was a lot of reaction in Indiana as a conservative state, concern, sort of a reaction against the mandate quality of everything, Dr. Box had such a straightforward and I would say a winning personality in the way that she was received by the public. And even people who may have disagreed over the specific issues of what should be done or what could be done or what the state could say that you had to do, even those who disagreed with her, I think, respected her integrity in the process. So that was a fortunate start for us to do that. And my prior experience in the legislature, as you know, Dr. Adams, having come before my committee to get budget requests done, was that I was the chair of the Appropriations Committee in the Senate and had been chair of the State Budget Committee for quite a while. And so I was a link to the money and had worked on these types of things for quite some time. When I got engaged in the process, I think my perspective was that, well, Indiana did have a very poor public health ratings and on a lot of the specifics, and I recognized those. I was concerned about those. And so probably my approach was to turn my attention to, well, what is it that we can do and how is it that we can get legislators to agree with us? And Dr. Box and I agreed on a process, and really it was I think Dr. Weaver, and I know this is accessible to people otherwise, Dr. Monroe can lead us to these things too, but we set up a process whereby we had, not only did we have broadcast the commission meetings and invited comments, on a once a month basis. But we went out around the state. We did 7 listening tour events where we actually just listened and made no effort to contradict or argue with any presentations that were made, pro or con, about this all around the state. And then I had suggested to Dr. Box, I said, in order to sell this, really your audience is the legislature. Mm-hmm. And if you can get them to pass this, it doesn't matter what the other 6.5 million Hoosiers think. They have got to make the decision for those 6.5 million people. And so in order to get this effectively done, we have to get our message to those people who deal with legislators on a regular basis. And so I helped line up, and Dr. Box and I eventually did about 50 presentations to everybody from the Indiana Chamber of Commerce to the Manufacturers Association to the local government elected officials. We did 3 or 4 with them, to different people, the Indiana Hospital Association, anybody who worked with the legislature on an issue that was connected to us. We made a presentation in the months ahead of the legislative session. And we tried to persuade them that this was something that needed to be done. And we were met with some pretty good reactions on most fronts. But this was not a quick, short-term success. And when we actually got in the legislature, I think we met individually with at least 75% of the Republican legislators who served in the Indiana General Assembly. And we never tried to sell them on the idea that there was going to be a mandate or that this was a state-run entity. In fact, those were mostly the suspicions were that this is a hand down from on high that is going to sort of tell you how to do everything. And we actually posed, and this was something that I probably picked up from my prior experience, probably the best thing to do is to make this a local decision-making process with the assistance and help and partnership of the Indiana State Department of Health, and that the counties could decide even whether to participate or not in the program or to stay in it or to withdraw. Of course, the big carrot was, you talked about a 1,500% increase in funding. We set it up so that the state would provide 80% of the funding, and we required a local 20% match in order for for them to have some skin in the game. But we kept reassuring them that this is your program to implement, and Indiana must do better, not only as a state, but in your county. So we want to find ways that you can agree with us on how we attack public health or how we produce health equity or how we get to where we want to go. And you're driving the ship. Mm-hmm. And we convinced them, and I think, and I hope Dr. Weaver will chime in here, I think they ended up believing those statements, that they agreed that they would be in charge in that sense. And I think ultimately that's what sold it. And I think that would apply in a state that might be conservative or a state that might be liberal, because in every case, those local elected officials are very close to the public. They're very close to the people, and they have their finger on the pulse of what will sell and what won't sell in their particular county. And so we kind of built on that pattern. And without being too self-congratulatory, I did feel like at some point, and Dr. Weaver may want to, she may laugh or she may want to comment about this, but I did feel like I felt like I had been, in a sense, almost trapped by the situation, because I could see that if I did not get involved and try to be a champion in some way, as you talk about champions, Dr. Adams, that probably it just wouldn't happen. There needed to be a connecting link of somebody that they knew previously and were willing to discuss this with. And so I had a lot of honest, angry conversations with people. But in the end, they were very productive because I had the kind of relationship that I think you needed to have in that slot. Now, that's only one slot on a roster of an entire football team that was out there trying to make this happen. So I don't want to
But it was a critical one.
That, but it was one that had to be filled. And I agreed that, okay, I'll give it my best effort. And I would show Dr. Box my schedule, and I would say, what is going on here? Does this look like the schedule of a retired guy? And so I would tease her about all these calls that we had to make, but we worked our tails off, and it was a very effective team.
I love that. I love that. And when I was health commissioner, I used to always say, I'd much rather have a local business leader or a local legislator advocating for a particular health issue than even me as health commissioner.
Right.
Because they knew what I was going to say. I was Mr.
Right.
Goody Two Shoes coming in to tell them to stop doing all the bad stuff and give me more money for the good stuff. And so
Right.
having that champion is critical. I often think about Senator Bill Frist in Tennessee and how he's become a champion for health issues in that state, very much framed around the idea that he was an extremely conservative legislator prior to him taking on many of these health advocacy roles after he left Congress. So, Dr. Weaver, I don't want to downplay the importance of having the health data and that credibility. Can you help us understand from your vantage point what the role of the health commissioner was in Indiana's success here? What is it that you've done? What is it that Dr. Box did? And how was it critical to helping get that message across and give that context for the advocacy of folks like Senator Kenley?
Yes. So, hi, Dr. Adams. It's good to see you. Thank you for having me on. And also to Senator Kenley. I just want to echo what Senator Kenley said. He is not, he's being humble. Honestly, him and Dr. Box leading the Governor's Public Health Commission, and I will say alongside Congresswoman Brooks and also Dr. Judy Monroe, who was a former health commissioner in Indiana, but now with the CDC Foundation, that the four of them being a part of this process really gave it a lot of, people were paying attention. Something's going on here. But I think the rest of the makeup of the Governor's Public Health Commission also contributed. So a mayor, a county commissioner, the director for the Indiana Minority Health Coalition, the executive director of the Hospital Association. I mean, it was a really important group of people. And Senator Kenley mentioned, many times throughout as they were meeting that everybody showed up. So they met over 9 months. There was a lot of material to review and they did their homework. They asked questions and they were engaged. And because all of them were at the table throughout the entire process, they were able to represent, this is how the mayors are going to want to see themselves in this space, right? This is what the county commissioners are going to want. And then, of course, we had Senator Kenley, letting us know this is what your legislators will be looking for. These are the questions that they're going to be asking. And I think Senator Kenley wasn't the only one. I feel like a lot of people were brought along over those 9 months and they just listened to the data. They saw the information. They saw the opportunities. And it wasn't just, okay, here's where we are not doing well. There's also suggestions for solutions. And I think
Dr. Weaver, you said opportunities. I just want to stop you there. And I want you I want to pull on that thread a little bit because you said the data. And when we present the data, it's usually a negative. Indiana's the 48th this, the 47th that, the 35th that. It's usually negative, but you said opportunities. Can you tell me a little bit more about what you're referring to there?
There's only one way to go, and that's up, right? So you can only get better. I think what helped here, and I saw Senator Kenley and Dr. Box say it over and over and over again, is that they pointed out where Indiana had invested in the past. So in our economy, in our education, we do really well in our national rankings. And then they showed that here in public health, where we had not invested funding for, throughout the history of investing in public health, we're performing low. So I think showing that is really where it was like, oh, clearly there's an opportunity here. We haven't invested in this space. And I think that changed the mind of many of the legislators. I think Senator Kenley would agree with that, but also people throughout the community, including the businesses. I think they also, saw that as, okay, maybe we really can do something to turn the tide here.
That's fantastic. And so I'll throw this out to either one of you all, but I remember a moment And many people will know that as Surgeon General, I put out a report called Community Health and Economic Prosperity, making the business case for health. I tried to do this also when I was state health commissioner. And with some success, we were able to get buy-ins from people in the business community. But the point that I remember is when Dave Ricks, who, for those in the audience, is the CEO of Eli Lilly Pharmaceuticals, said at a statewide economic forum that Indiana's poor health was going to impact our ability to be able to recruit workforce and then to continue to bring jobs to Indiana. And both of you mentioned business, but I'd love you each to expound a little bit on the importance of making sure we have business buy-in and how when businesses come to the table, it can really help legislators see the benefits of health beyond the ways that Dr. Weaver and I tend to think about and traditionally talk about health when we're in the hospital.
I think the discussion, it was interesting because the Manufacturers Association and the Indiana Chamber of Commerce, they both came on board, but knowing the extremely conservative nature of the Indiana legislature, they were a little reticent to go all in. And I mean, they never wanted anybody to think that they were not for these things, but they held back clearly in terms of the amount of work that they did on this particular issue. And so as time went by, in our discussion with the legislators, we began to emphasize the fact of, look, you guys, maybe Indiana's conservative, so one of the places where we spend a lot of money in our budget is to try to attract good businesses to Indiana that have higher wages. Well, when you try to do that, the people who are going to be in those businesses are going to be employees, and they're going to be in your community. And more and more and more, they're asking, what kind of a healthcare system do you have in this particular state? Of course, we had a miserable record of state funding. So that made it, we were so bad, it made it easy to say, you can't do this much. You have to do at least something. I think, Lindsay, I don't know how many counties we had where the total expenditure was less than $10 a person a year for public health. And so we were so bad that it was almost anybody would accept that and couldn't argue against it, any more spending. But the idea was, if you want to have economic development, you got to have a place where people want to live. And if you want to have people live here, they've got to have some decent health care. And the best people to decide that, we decided early on, was at the county level. We decided that those people were the ones that should take a share of the issue. And so the thought was, in addition, probably the most important group for us to win over were, before we got the legislators to agree to this, we actually got the local elected officials to decide that this was important. And so we knew that they needed to have a stake. They needed to care what happened. They needed to be put in charge of the money so that they would be held responsible. And they recognized right away that that's what that was. Mm-hmm. And so really, one of the main avenues of getting legislators convinced that you needed to vote for this was to get the counties that they represented so strong from their county commissioners and their county council that they were actually calling their legislators and saying, look, we don't have any more money. We can't find it. The only thing we have is property taxes, and that makes people madder than heck. And so we're going to have to do something about this. And the state is offering us to copay on the money, and it's a pretty generous copay. And they're giving us quite a bit of authority over it. So we need for you to vote for this so that we can do this back home the way we want. And we tried to avoid the discussions about, well, what about a mask mandate? Or what about a vaccination mandate? Or what about a business being closed? We would say, look, those are experiences we went through in the pandemic. Mistakes were made, things were done right. Who knows what the answer is, but we do know that we have to do a whole lot better in your county particularly these 65 rural counties, which are really underserved. And so those were the thrusts of the argument that they kept coming out a little more strongly. And then we finally got the Association of Indiana Counties and their executive director, who was a very nonpartisan person. I would say that's the most advocacy I have ever seen out of that gentleman on any particular issue. He could see that this was a winner, that his guys were the people that are going to get the money. They were going to get to be making decisions. And to some extent, my prior relationship through the funding with the counties helped facilitate that a little bit. But wouldn't you say, Lindsay, that that was a big continuum that had to be established, and that the local elected officials, mayors and county elected officials, talking to their reps and their senators was a pretty decisive moment in terms of turning the vote toward us, as opposed to just saying, I'm against this because mandates are involved. And Jerome, I'd like to talk a little bit later about how we tried to dig into the people who were the opposition, but I want Lindsay to add her comments to what I'm saying here.
Yeah, I agree, Senator Kenley. And I'll add another point. I mean, I really applaud Governor Holcomb and you and Dr. Box, where many states were turning away from public health after the pandemic, that you guys really turned into it. Because, and to go back to the counties, that's where we really saw good things happening, right? When people needed access to testing, it was the counties that were figuring out how to do it. They were the ones trying to figure out how to get through all of this. They were working with the businesses. And so I think that they appreciated that we recognized that, and that these things were best done at the local level, because they truly knew what their issues, they know what their issues are. They know what their community needs, what their community will tolerate, right? What will be acceptable to them at the local level. And so I think they appreciated that. And then also with the businesses, that's why it was also very good timing. Coming out of the pandemic, the businesses really recognize how much health affects the bottom line, right? You need a healthy workforce to be able to get the job done. And it's, it's absenteeism, but it's also recruiting. So we're actually going around and talking to all the counties, just learning from them. How are they planning on using the funding, et cetera? And I've had more than one, Chamber of Commerce person tell me that they've given presentations to prospective employers to bring to their community. And when they got to the health presentation, that was when the door was shut. That when they said, oh, well, we're the 46th most obese state, we're the 45th highest smoking, that was a game changer. But I think what the exciting thing about this funding is that those metrics, of course, aren't going to change right away, but they're going to be able to share, here are all the things that we're doing locally to address that. And so they're excited. They've been at the table. And I agree about the Association of Counties. We continue to have good conversations with them. They're leading this at the local level, them reaching out to their state elected officials and telling them, we need this funding. Senator Kenley said several times, and I agree 100%, this was one of the biggest, if not the biggest investment we made in rural Indiana. So they had been footing the bill for local health for a really long time. And, if you have less than 10,000 people in your county, you're not going to generate enough tax revenue to really, truly take care of your community. So there was a huge difference based on where you live, how much funding was available, what kind of programs and services were available. Every county was a little bit different, but you can see definitely when you went out to the rural community, that was the biggest disparity.
Dr. Weaver, how did you get your folks at the health department to shift their thinking from morbidity and mortality to workforce and ROI? Because we tend to think about, there's a saying, if all you have is a hammer, everything looks like a nail. But we tend to think in ways and use vocabulary that I often feel doesn't resonate with many of the stakeholders who you all are talking about. How did you make that shift, or how are you making that shift? Because I know it's an evolution.
Yeah, we've pretty much flipped how we're doing things at the Department of Health on its head to support this work. We saw such enthusiasm and excitement at the local level to be able to do these things locally that we realized that we needed to make sure that we were supporting that. So we've actually developed regional teams, so groups of people in the northern part, central and southern part of the state, fully customer service. They're there to answer questions for local health departments and elected officials, bring together community-based organizations. So I think that's another important part of this legislation, is that it actually requires the counties to bring together a bigger group of stakeholders to help make decisions about how the funding is going to be utilized. So it's not just for the local health departments, it's truly for the community. And so we're helping to support that. And also, for the longest time, all 92 counties, 95 health departments were head down, doing their work, trying to get by. And now we're pulling them up out of that and getting them to work with each other, right? Share successes. Here's a program that really worked, but also show, maybe they started something and it didn't work. And so that, is something that they now will have the ability to pivot away from and share that with other people. So really working together. And then also the acknowledgement that not every county has to be able to do everything to the fullest, right? So a really good example is tuberculosis. So every single county doesn't need to have a person that is doing tuberculosis case management. Our cases aren't that big, right? So now we have the counties are actually working together to say, okay, maybe we'll have one person amongst the three of us, which I think will help make this funding go that much further.
I love that. So, Senator Kenley, we've let you warm up a little bit in batting practice, and you gave me permission to go there. So I'm going to ask a couple of tough questions here. What were the main arguments against increasing support for prevention and public health? We talked about the good. What were some of the challenges? What was some of the bad? And how did you respond to those arguments against increasing support for public health and prevention?
Well, the issues that came out during the pandemic about business closures and whether you should or you shouldn't, the issues about vaccinations and whether you should or you shouldn't, the use of a mask, to many people, and I come out of that environment, and that's the world that I was raised in and lived in, and so it's in today's world, what happened during the pandemic, and by the way, Lindsay's perfectly right. This pandemic was the exact right time to focus on the issue and go for it. If we had said, this is too hot, we got to wait, that'd have been the biggest mistake we ever made. Yeah. And so the opposition, this was Big Brother in real life. This is the fight about, are you entitled to carry your gun anywhere you want or not? I mean, it's the same issue in these people's minds. And so the social media and the way that it is being used and manipulated in today's world, which fortunately I'm just too old, I don't pay any attention to social media anymore, but that was being used to say, here are all the things that they're going to do to you or that they can do to you. And it had a life of its own through social media. And of course, most political people, particularly younger people in their prime age, they know that you have to pay attention to this because that's the way dialogues are being carried on in our society right now, either fortunately or unfortunately in some cases. And so I personally tried to find out who was the head of the social media movements that were putting out the things, the information about why this was a bad idea. And so I got a few leads and finally got a lady from Putnamville, Indiana to talk to me. I said, well, who's actually in charge of this? How can I talk to them? How can I work with them to alleviate their fears? Because you can't find a more conservative guy around here. I mean, I was raised as a Christian Scientist. When I went in the Army, I had never had a shot in my life. They gave me 36 shots the second day I was there. And so I said, let's find out what's going on, because I don't think this is what the intent is. I think the intent is to make your community be more healthy and to do it from a local base of people you know and trust, and you can walk right into their office and talk to them 365 days a year. And so the movement, like many of these movements today, is really driven by a very small group. There is some national funding out there that tries to help them drive it. But I found out that in reality, this was an extremely small group of people. And actually, I think the activists in the entire state all put together when they came and testified before committees, although it was a pretty intense situation and it felt pretty conflictive and pretty combative. The reality was, I don't think there were more than 100 people that actually really paid attention to this. And so I kept trying to reach out to them and say, look, come and talk to me about this, because I'm probably out of your stripe. And if we're doing something wrong, I want to know it. But I know that you want your people to be healthy, and I know that you want to have the final authority. Another issue that came up was medical records. Somehow or other, they were going to everybody's record was going to go into this collective data file, and it was going to fulfill all the dreams of 1984 or any other book that's ever been written about this subject. And of course, we never even discussed any of that kind of stuff. And then you're going to interfere with my relationship with my doctor. In other words, my doctor is not the one that's going to get to decide this. Somebody from the health department is going to say, my kid can't be in school until they do this, And so we tried to reach out to them. I wasn't able to get to I felt like I talked to the real person who was the driver behind it a couple of times, but you just have to keep trying, knowing that this is an exercise in trying to maintain your own credibility and your own integrity about this issue, rather than allow yourself to be drawn into a combative relationship where you just argue against them. And
I love that, Senator Kenley. That's amazing to hear you say that. And I learned something today, because I did not know that you had worked so hard to combat some of that social media misinformation and disinformation and mistrust that in many cases comes from a well-founded place, particularly from rural communities. But we're about halfway through. I just want to reiterate a theme that each of you has brought up over and over, and that's local. It needs to be locally led, local control, local conversations are key. This wasn't top down, as much as we want to give credit to Governor Holcomb, and he deserves credit. This wasn't top down, thou shalt do X, Y, or Z is what I'm hearing from you all. I'm hearing you say that it really took a lot of groundwork and reassurance and effort on the local level to make this happen. But Dr. Weaver, I want to throw this back to you. I asked Senator Kenley what were the main arguments against increasing support for prevention and public health. And a lot of what he brought up were political arguments. But one of the things that I have to admit was shocking to me when I was health commissioner was how often you would actually get pushback from medical and health professionals. And a lot of that was related to resources or data. But I just wonder what your thoughts are, Dr. Weaver, on pushbacks against this from medical and health folks around the state.
Yeah, I think, again, having them at the table from the very beginning and part of the conversation. We have to say that healthcare costs did come up over and over again throughout all of this. Just a recognition that healthcare costs are going up. We do have a sicker population. It is hard to care for someone if they are unhealthy at baseline. And, there's even a question, well, what's healthcare doing in this space? And they came out and said, we're doing everything we can within our four walls, but somebody has to be doing the work in the community, right? There's so much more than is done. And honestly, the majority of our health comes from factors and healthy behaviors and everything else that is outside of what medicine can prescribe. So they were right alongside of us, pointing that out, that walking trails.
Don't blame it all on us. We're not going to fix this in the hospital.
Right, exactly. That there's a greater community need here than what we're able to provide, but that they are going to be at the table too. And that continues to be a part of the conversation. I think the other thing I wanted to emphasize is that from the very outset of this legislation, it is opt-in. The counties got to decide, every single one of them individually, do we want to take the funding and then address all these core public health services, or do we want to continue to get the funding that we did, that we have for the past 20 plus years? So it was their decision. We did a lot of work. So they all had to decide by September 1st. So even after the legislation, the work continued through the summer, and it was really just showing up, being, available to answer questions, dispel the myths that continued to float around after the legislation passed, and really show them, let's go through the statute together, where it clearly says you have the ability to opt in, you get to spend this funding, how you want to spend it to address the core public health services. Very few guardrails there. At least 60% of the funding had to go to the more preventative health services. No more than 10% had to be spent on capital. But beyond that, it really is up to the locals on how they want to spend that funding. Now, there's accountability piece. So we're going to have state level key performance indicators that all the counties are going to be able to, or will have to track to. And they'll have to come up with their own local county key performance indicators by December of next year. The budgets have to go through the state budget committee. So there was all these kind of accountability pieces, but it all really did go back to that they were able to make that decision locally.
Dr. Weaver, one of the questions that I wanted to ask you is an update. You mentioned that the counties had the opportunity to opt in, opt out. How many counties have actually opted in after you've had these conversations with them?
We had 86 of our 92 counties opt in, which we are ecstatic about. If you would have asked us at the end of the legislation, I don't know, Senator Kenley can put in his guess, but we were thinking around 60 based on prior conversations. But again, the work that went through the summer, and I will say, the Association of Counties that Senator Kenley was talking about earlier, they were the ones that were leading most of these conversations, as well as the county councils, the Association of Mayors. It was really them working with their local elected officials to answer questions. And of course, we were there to help as well, but it was really led from that side. But they also, we had in some counties that were hesitant. It was the healthcare community coming out and saying, this is what we need to do as a community. We saw businesses step forward and advocate to take the funding. So it really had kind of this groundswell from the community that they saw this was important, which is really good because they all need to be at the table to figure out, exactly how that funding will be implemented.
And tough question for you, Dr. Weaver. So, and first of all, congratulations. 86 out of 92 is more than what I would have expected to opt in our state. So that is tremendous. But I'm going to ask you a tough question. Of the 6 that haven't, what are your thoughts as to their reasons, or did they articulate reasons as to why they didn't opt in? Because we always want to ask ourselves, not just how do we celebrate the successes, but how do we help empower those who chose not to, or who for whatever reason aren't benefiting from such legislation.
Absolutely. And we continue to have great conversations with all of those counties. We're hopeful. We think many of them, if not all of them, will opt in next year. So they have the ability to opt in every year. And also everybody has the ability to opt out at any point too. So really important to point that out. So talking to those counties, one just wasn't ready, which, good for them. They recognized that this was fast moving. It would be a significant amount, of more funding than they had received in the past. They weren't ready to figure out a plan and how they would implement it. A couple other ones just wanted to sit it out a year and see how it went for the other counties. And, a couple of them were still worried that are there some strings attached to this. Mm-hmm. And they've already since then, since September 1st, we've heard from a few of those counties, we see the light now. We see that people are excited about it. They're starting to talk about and even implement already, using ARPA funding, some of the programs that they wanted to implement. And so I think that, it's really been positive, and there's no negativity around them opting out. We meant it when we wanted it to be their choice.
I love that. And I just want to reiterate to the audience that anyone who's a leader or who's taken a management course knows that change management is difficult. And you have your early adopters, and you have your folks who come along in the middle, and then you have your folks who are the wait and seers. And so no difference here, except for the fact that we got a tremendous number of people in Indiana, more than what anyone ever expected, to jump on the ship early. So again, want people to understand you can endorse and buy into the concept of local control, while, as Dr. Weaver mentioned, still making sure you have guardrails, and you can still see tremendous success, while acknowledging that there are going to be some people, when you do give that local control, who choose not to do some things, and that's okay. That's okay. You just keep working with them and you keep staying positive. So Senator Kenley, last tough question for you, but this is one that's near and dear to my heart. I'm the director of health equity at Purdue University, and part of my charge from former Governor Mitch Daniels, who was the president at Purdue who hired me, was to help build out our health equity strategy, including helping us think about how we talk about health equity in the state of Indiana. And we know that there are attacks on words like disparities and equity at the moment, but I often will point out, hey, old versus young, male and female, rural versus urban. Those are all places where we see inequities. But the question I want to ask you, Senator Kenley, is that health equity was specifically included in Governor Holcomb's charge to the commission. So how did you work to sell this concept of health equity to Hoosier legislators, particularly at a time when many people see equity as a bad word?
Well, the first thing I did, Dr. Adams, is I never used the term health equity. I think the problem is that's a really accurate description of the problem, and whoever thought that term up, it does encapsulate very well kind of the issue that we need to drive at. Mm-hmm. But I think it's become a term of conflict, just like climate change has. And so I used to tease Dr. Box when she would start talking in those types of terms. I'd say, you shouldn't do that. You should say, what do the people in your county need to be healthier? Mm-hmm. They're not so dumb that they don't understand that there should be equity involved in that solution. I never heard a person say, I'm not interested in equity. So it kind of has to do with that. And then the next thing you have to do is, I think you have to listen to the response. You have to listen to them. Yep. And then try to solve their problems. I remember one legislator who was, he'd been in the legislature for 14 or 16 years. I didn't realize he'd been there that long. And he was becoming a person who had been there long enough that people were beginning to respect his judgment on things. And so I said to him at the end of this, I said, I know this kind of works against your instincts about how you don't want more government and you don't want government into your issues. But, let me make this offer to you. If you want me to come back by myself so we can just have a talk, one legislator to another, so that I can talk through some of the things about it, why, let's do that. And he actually did call me and asked me to come back. And the conversation was couched in terminology that was digging right at the issue of health equity, but he refuted the value and of the importance of framing the discussion that way. And I just let him talk the way he wanted to talk. So you have to meet people on their ground, and you have to listen to them, and then you have to be perceptive enough in the relationship that you're able to kind of pull out the essence of where we do have an agreement. I think I hate to make this editorial comment, but I think that's really the heart and soul of all of these enormous conflicts that we seem to be having, even on a national level. On virtually, you can't raise any issue with somebody without these things coming to the front. And I think we kind of somehow or other had a credibility, and Dr. Box had the credibility, and Governor Holcomb was just right, because he never backed away from his commitment to this program. but he didn't go out there every day and bang on the table about, you have to do this for me or something like that, So there was a lot of leadership involved all up and down the ladder, starting with Dr. Box and working through the members of the health department, the members of the commission. We had a mayor and 2 county commissioners, and they all 3 hated the program after the first meeting. And yet by the time we got done, they were absolutely our greatest testifiers in favor of this process.
Yeah.
Well, Senator Kenley, that's... Oh, go on, Dr. Weaver.
I was going to add one thing to that. So I believe one of the more powerful tools in starting that conversation was sharing of life expectancy based on county. So showing that, our life expectancy in Indiana had actually plateaued and then started to decline, and then showing the difference in life expectancy. We have almost a 10-year difference depending on where you live, 81 years in one county and as low as 72 in another county. And that was a huge eye opener to our elected officials, to people in the community. And even you can see them immediately trying to find their county and be like, what should I be expecting here? And I even heard some of them say, even if they had a higher life expectancy, they felt bad. Like, what's going on in that county next to me? What do they not have that we have here? And so it just started the conversation without using the words that, people find inflammatory or offensive or whatever. It was just utilizing the data and the information to start a conversation.
Dr. Weaver, thank you so much for bringing up that point. I often say, a little bit tongue in cheek, but also very directly when I'm discussing these issues with people, that there was a study once upon a time that showed that 80% of people believe they're above average drivers. And so the point of that study is that until you show people the data, they're going to continue to convince themselves that they are at or above average. And so you have to be able to have those conversations, as Senator Kenley said, in a non-confrontational way. But you also then need to bring that relevant data to help contextualize that conversation for people, to help them understand, okay, this is why it matters to me, that local data. And I want to say that because I think it's critical that we understand the importance of the data, while acknowledging that the data alone isn't going to make the case. There's a saying, people need to know that you care before they care what you know. And what I hear from Senator Kenley is you got to work hard to show people that you really care about them, but then you still have to have the data to prove to them why it actually matters and why they should do something that they might not be inclined necessarily to do. And Senator Kenley, I just want to give you a shout out because you showed why you've been such a successful legislator over the years. You do need to meet people where they are. Anything in life is about relationships, whether it's your wife or your kids or someone in the community. It's understanding, hey, if there's a way that I'm speaking that's offending you, then I'll use different words. And let's try to figure out what the goal is, as opposed to trying to force that conversation about the language. And I think that's something that we struggle with in public health is being okay with the common goal and not trying to force language or be the language police all the time, particularly in these conservative states. We got 7 minutes left. I'd love to get some closing thoughts from you all, 2 or 3 takeaway points that you want the audience to leave with, particularly about how we might apply these lessons in other states. And I'll start off with you, Dr. Weaver, because we've had Senator Kenley talking for quite a while. I'll let him close. But what are your 2 or 3 takeaway points that you would leave for the audience?
I think that people keep on asking what was the secret here, and I would say, one, it was the right leaders, that we truly had people that are very well respected in the state leading this conversation. I think 2, it was showing up to what you were just speaking about, the fact that Senator Kenley and Dr. Box did 50 had 50 conversations with different people. They went all over the state to do listening tours. We continue to go around to counties and communicate with people. That's how you show them that they care. Instead of, calling in from Indianapolis all the time, we're actually going out and talking to them. And even more importantly, we're listening and we're incorporating that in our conversations and then what we do moving forward. I do think that showing people the data and the information matters. But I think to your point too, you also have to show that it's not just information, that we understand that there's something more behind that. So we have a county health scorecard now that we're helping the local counties utilize so that they know really where they should be focusing. It's looking at 7 health metrics. It ranks every county 1 to 92. The powerful part of that conversation, when we go into the community and we share with them, here's your metrics, especially our rural communities, those are people behind those numbers. I mean, they're immediately able to say, we know what is driving this. And it's not just the public health people. I've had a police chief raise his hand and say, I know what's driving this. A local family practice physician, EMS, fire, the local elected officials. And so you can see them, that will help as they're trying to figure out what they're going to do moving forward, that, okay, here's what our ranking is, but here's how it's actually affecting our community, and here's how we think that we should address it. I'm really excited. This is an exciting time in Indiana. I know that we're going to be successful because whatever Indiana puts its mind to, we get done. And we've shown that over and over again. And I'm just thankful to be a part of it. And thanks again for having me here today.
Yeah, fantastic. Senator Kenley, take us home. What are your 2 or 3 closing thoughts?
I think in America, whether you live in a liberal state or a conservative state, I think one of the things that we love the most in America is our freedom of choice and our freedom of the individual. It doesn't matter where you are on the political spectrum. And so another fact is that those of you who work in the healthcare field and trying to deliver public health, it's such an obvious fact that if you live and do certain things, for example, discussing smoking or the use of drugs or those kind of things, the facts are so clear that it has such a huge impact on how long you're going to live and how you're going to succeed, that in reality, it seems completely indisputable. And so when healthcare professionals meet regular citizens or even local elected officials or even elected officials, their whole internal unspoken attitude is, how can you be so stupid as to be against this? Or how can you argue against the plain facts? But the reality is that those other folks are focusing on other things as their primary concern. And one of the things that's a bedrock, no matter where you are in America, is the freedom of the individual to lead their own life and make their own choices. And so if you want your facts to succeed, then you have to get on that person's ground and decide how it is that they're making this decision, and then help them make a decision that is not only right according to the facts, but one that they feel that they want to advocate for, that they want to participate in. They want their county to have this system of health care. And so you've got to convince them to make the right decision. But in the end, you've got to convince them in a way that they feel like they made the decision, not you.
And as I mentioned, that's any relationship. And I'm so glad you closed on that point, Senator Kenley, because we focused on the fact that Indiana is a conservative state. But I agree with you. This is something that can be effective and historically has been effective, whether you're talking to Democrats or Republicans. The fact is, America was founded on the idea that people didn't want the government telling them what to do. And most people who've immigrated to the United States are leaving countries where they don't like their governments telling them what to do. And so you have to get that buy-in. And when you invest the time and the energy and the resources in getting that buy-in, there's nothing that you can't achieve. And you all proved that here in Indiana. So Senator Kenley, Dr. Weaver, thank you so much for taking the time today to have this conversation with us on this panel. Thank you for your work in Indiana. And thank you for the what I know will be impact nationwide from people hearing about the work that you've done.
Thank you.